So the NCLEX could soon be fully remote in the United States, meaning nurses might be taking their licensing exam from home instead of a testing center. So let's talk about why this matters and why it should be held to the same standard as other professions. Physicians already have multiple boards that offer secure remote exams after COVID forced the shift. And while they've had bumps in the road, those boards invested in technology and oversight so doctors wouldn't lose credibility. Lawyers in California tried a remote bar exam and it turned into chaos. Students were locked out, proctors failing, and eventually lawsuits against the testing vendor. So the court stepped in to protect the integrity of the profession because nobody wants to question if an attorney really earned their license. If we expect the same accountability for physicians and lawyers, then nursing deserves the same safeguards. A nurse's license carries just as much responsibility for patients' lives as a physician's order or a lawyer's signature on a legal document. So the pros of a remote NCLEX are very clear. Access for students in rural areas, lower cost, less travel, and potentially less stress in a familiar environment. But the cons are just as real. What if your Wi-Fi crashes mid-exam? What if the software falsely flags you for cheating? Or what if a glitch ends your test before you even begin? Nurses already face enough stress without worrying about whether a technical hiccup could cost them a license. So the bottom line is that if the NCLEX goes remote, it has to be done with the same level of security, oversight, and support that physicians and lawyers get. Nurses should not be treated as second-tier professionals when our role in patient care is very critical. The system has to guarantee fairness, protect exam integrity, and build trust because the public deserves to know that every nurse at the bedside passed a legitimate, reliable exam. So what do you think? Should the NCLEX be remote like other professional boards, or should it stay in a testing center until the technology is proven?